Hey y'all, I'm Kelly Moody and you're listening to the Ground Shots podcast, an audio project exploring our relationship to ecology through conversations and storytelling with farmers, herbalists, craftspeople, naturalists, artists, and more. Hey y'all, it's Kelly. Welcome to episode 8 of the Ground Shots podcast. Currently in Nevada City, California, and it's a cool, sunny morning with moisture in the air, which is quite a sweet relief, as we haven't really had much rain this fall. And in the West, there's a rainy season and a dry season generally, and usually by now, it's late November, usually by now there is some rain coming down, so we had a good storm the past couple days. It put probably some fires out for sure that have been burning, especially the campfire, which is just north of where I am in the Sierra foothills, and it's been pretty eye-opening to be so close to a fire and a place that I have spent time and really looked at the plants and the land there where it burned. So it's pretty shocking, honestly. The land will recover. You know, it was a crazy fire, but I feel for the people that lost their homes and lives, especially a lot of older people who lived in that area and live in that area. So there's a lot I could say about wildfires and fire ecology and fire tending and like better ways we could deal with that. And I don't really know right now how I can really talk about it. Because I'm not the expert, but there's so many layers to it all. So I really, really hope that, it's going to be a long winter for some of those folks without homes. So it kind of humbles me when I sometimes get stressed out about, having mobile shelter that has issues at times. Like when the rains came, actually, I had done a lot of sealing around the outside of my camper, and even some of it like a week or two before the rains came, I kind of was like, okay, I'm preparing. My camper hasn't been too leaky in the past, but I had a feeling that when things are in the sun and they get exposed, it creates more wear and tear. So I just was like, you should do it every year. And all of it failed. It like peeled off like cottage cheese. It was like, oh gosh. Okay. And I have some leaks. And we have a couple sunny days here, and I'm trying to dry it out with a electric heater. And there's another storm coming. That's how it goes. Once the storms start, they often keep coming. So I'm not sure how I'm gonna remedy this. Because it should be dry, and I probably could just find a better sealer. So just some of the cons of camper life is sometimes your bed's wet and it's really hard on your mental health. But I'm feeling grateful today. The sun's out and my space is cozy and warm and it's drying out, and at least I have a space. Just trying to keep that in perspective when thinking about I'm choosing this lifestyle, and there are other people that did not choose to be made homeless. This episode I'm really excited about. I interviewed a bunch of people in Oregon this summer when I was traveling through there, and I met up with my friend Mario, and this is our conversation. And Mario is a naturopathic doctor now. And I've known Mario since back in the herb school days, and I'm remembering in the interview we couldn't remember where we met, but I'm remembering kind of now that I was living in Northern Virginia and Mario was living outside of Baltimore, or like in a different, outside of Baltimore in another town, and our mutual friend Lindsay was going to school at what was then Thai Sophia Institute, and now it's called something else that I don't remember, Maryland something health. And the students there were required to do free, teaching for the community, a certain amount of hours of community teaching in Baltimore, and Lindsay invited us to come to this free school that was in Baltimore where there were some really cool herb classes happening, and we met there and then formed a friendship from then on. Yeah, so it was really sweet to meet up with Mario and catch up with what he's doing now, and really excited about what he's doing as a naturopathic doctor in Oregon. Though we talk a lot about the inaccessibility of naturopathic medicine at times, and how Mario is sort of trying to figure out different ways to change that with his practice. And we talk about herbal apprenticeships, the ones he did with Corey Pine out of Asheville, North Carolina, and Sevensong out of Ithaca, New York, and kind of the impact that they had, and their going to the Rainbow Gathering to do free clinics, how all of that had an impact on Mario's perspective on primary care and herbal medicine and accessibility. And we talk a lot about the healthcare system and just how we both desire kind of a cultural reframing of ideas about healthcare and access to it. And also we dive into the conversation about the opiate crisis that's happening right now, and how Mario is sort of working in that realm, and again, the cultural ideas we have around addiction and also poverty, all of these intersections. And we talk a little bit about what opiate withdrawal looks like and the treatment of opiate addiction from a harm reduction perspective, which is Mario's point of view. Yeah, comes from that place. And I really appreciated just being able to have that conversation and learn a little more about that, and something that I've been reading a little more about and listening to people about, and I've seen it affect a lot of people's lives, and some people that I know more personally. So I think this is a good episode for education around that, and also just thinking about different ideas of how we see access to herbs, and how we think about shame and mental health and drug addiction and compassion. I think that's it for like what we talk about in this episode. And just want to remind folks that we have a Patreon, which has been such a huge part of this podcast. I started the Patreon to support publishing some of my writings, and I'm still in the process of doing that. But at some point, I've had this idea for this project for a while, and I just really wanted to add that on to the mix of all the things I'm doing. And even though it might have been kind of crazy to think about, I kind of thought maybe I would be starting it now instead of in the summer, or maybe next spring. But the momentum just kept going, and working with Heather of Opia Creative, I was just like, let's just do it. So Patreon has been huge. I can pay Heather to edit the podcast, and other little costs for the podcast are subsidized by the Patreon. So if you feel called at all, it really helps me to continue to do this and not pull so much money out of my own pocket. And the website is patreon.com/ofsedgeandsalt. The link to it is in the show notes, so you can find it there. And thanks again for listening, and I really hope you enjoy this conversation with Mario. Bye, y'all. Burn, burn with the light that reveals our faces. Burn, burn with the heat that will warm these places. So I'm sitting here with my friend Mario in Portland, Oregon, who is now an official naturopathic doctor, right?
That's correct. As of June 30th.
Wow. Yeah, and you're about to go do a residency.
Yes.
For a year.
Correct.
And what does that do that basically makes it so that then you can have your own practice.
So residencies function in a number of different kind of capacities. So it gives you the ability to practice, but also be working under someone else, kind of enhance your skill. It also, so my residency in particular is through my university, NUNM, and is a teaching residency. So in addition to seeing patients, I'll also be helping medical students, third and fourth year medical students, kind of to hone their skills, and I help teach some of the classes and also supervise them on shifts while they provide care to patients. And then, of course, in Oregon, naturopathic doctors, naturopathic physicians are licensed primary care physicians, so we are licensed with all insurance companies, or most of them. Residency allows you to be credentialed with more insurance companies and kind of provide more, be able to provide more services to people.
Do you have to do a residency to be an official naturopath?
You do
doctor?
not.
Okay.
No. So you can graduate and you can practice as soon as you pass your licensing exam and you get a license. But doing the residency kind of lets you do more things. And, there's so many places and ways to practice. So some people will go into private practice. Some people will work for larger companies or hospitals or in research or in clinics. So there's a lot of different places to go. I'd say the majority of indies go into private practice. But doing a residency, I think, opens a few more doors for you.
Mm-hmm. So can you just give folks a little bit of a introduction to where you're from and how you ended up here in Portland, Oregon, studying naturopathy? I know that's kind of a big question.
That's
and
a huge question.
I've known you for a long time at this point. And I kind of have watched you through the years and found you in the places that you've lived. And you can do it as quick as long as you want, or we can kind of come back to it later on in the interview. But
well, I'll do like the synopsis version, and we'll see where that goes.
Okay.
So I was born in Maryland, and I grew up in Maryland for most of my life, and I left Maryland. I left. I left first to study business in Quebec, and that did not work out for me. Was not really into that. So I came back to kind of figure out what I wanted to do, and actually was a biochem major, and at the same time was working at a health food store that I had worked at as a teenager in high school. And at that time, I kind of got into herbs. I was working in the wellness department, and there was an herbalist there who kind of I would hang out with and talk to, and I felt just really connected to that. And so I left school, and I left that job to go study herbs in North Carolina, in Asheville. And after doing that for a year, I apprenticed with an herbalist there.
Corey Pine.
That's correct. Corey Pine Chain at the Blue Ridge School of Herbal Medicine. I left after my year, after I was done. I had gone to Rainbow Gathering with him and met Sevensong at that Rainbow Gathering, and he talked to me about coming up to work with him in Ithaca, New York. So I did. And I did that for a year, which was awesome.
And we met somewhere in between Corey Pine I don't even remember when we met.
I don't either. It was around that time. I
really don't know when we met.
I feel like it was in the Corey Pine time.
Maybe, but I wasn't living in North Carolina at that time.
No,
but I met you somewhere in Maryland, maybe, with Lindsay.
Through Lindsay.
Or...
Yes, through Lindsay.
But I'm just not sure exactly when that happened.
Same. Somewhere in there.
Anyhow.
So I went up to Ithaca, studied with Sevensong, and I did Rainbow again because that's part of his school.
And so the Rainbow Gathering, can you explain to people who might not know what that is and what you were doing there?
Yes. So Rainbow Gathering is this giant, I guess, festival hippie gathering in the woods that's been happening for 40 years at this point, 40 some years. Definitely a long time. And basically people kind of go to different national forests and there's all kinds of music and events, and there's different like camps, and some people go for like skill shares and all kinds of things. But I went first with Corey Pine and then with Sevensong to do first aid, because inevitably thousands of people in the woods end up with various illnesses and accidents. And Sevensong is really into a lot of the hands-on first aid stuff, which is something that I never knew I was into, believe it or not. As a child, I hated bloody things, and now I love them. Give me an IND to drain any day, and I will do it. So anyway, I guess I went to these and found, like we were doing first aid with herbs, which was awesome. And
getting in there and working with people that had all kinds of things. I mean, it seems like anything from an acid trip to a staph to
totally.
Broken bones.
Yeah, abscesses, colds and flus, different. I feel like every year I was there, some sort of viral illness spread through the camp, and there was all kinds of expulsion at both ends. There's always so many things. And I really liked working, with the people that were there too. There's Rainbow attracts a lot of different people. I know that there are people there who are quite affluent, that lawyers would take time off their whatever to come to Rainbow, but there's also a lot of people there who, like, for some of them that was their only like healthcare for the year.
Wow.
That at least that's what they would say. Many people who are living homeless or whatever, and would come to just kind of get whatever care they could for whatever they had. It was just really, it was intense, but it was really great. And it kind of started a little seed that I don't think I knew what it was. I kind of knew there was a seed, but I don't think I knew what it was gonna grow into.
You stayed in New York for a while after apprenticing.
I did, yeah. So another, I think, key thing with Sevensong was working at the Ithaca Free Clinic. So he was one of the herbal providers at the Ithaca Free Clinic, which is a community health center that also had like a nurse practitioner and a medical doctor on the staff, and basically gave free care to those most in need in Ithaca and around Ithaca. And so we got to do that, giving herbs to those people, which was awesome because we gave out everything for free. It was really incredible. So that definitely helped form some of my way of thinking, I guess.
So you apprenticed with Sevensong, which is a role that only a few people get per year, where you work more closely with him and go to the clinic.
So basically you went to his school. So my class was a pretty big class of 20 people, and then there were 3 apprentices, and I think he usually takes 2 or 3, and so class was 3 days a week, and then the other 3 we worked for him in various capacities, including being at the health center with him, which was such a privilege and really awesome.
So there's a whole other group of people besides who you would have worked with at Rainbow that you got to kind of shadow Sevensong at the clinic.
Yeah. Yep. Basically, we sat in on the patient client intakes, and we get to listen to his line of questioning and listen to the person's story and why they were there, and get a sense of what was going on. And then sometimes he would ask us for input, or sometimes we would get to put together we did a lot of teas and tinctures because that's what he had. He got a lot of donations from some cool companies, so he was able to do that, which was awesome. And then after, so I had an experience at a Rainbow Gathering where there was someone who was quite ill, and a young boy, I don't know how old he was, but I don't know, somewhere in the 8, 9, 10 years old, and he was really ill, and I basically thought, this guy needs to go to a hospital, like he shouldn't be here, and he had appendicitis, and I actually saw him. This is so crazy. I saw him the year after, and he showed me his scar from the surgery, which was just totally crazy. And I remember just being like, wow, how cool is it that this guy, went and got this life-saving surgery, and I got to see him again and like kind of know that happened, and
that he was okay.
Yeah, that he was okay. and I remember being sort of fascinated by like, I knew that I loved the acuity of what we did at Rainbow. I liked having so many people and seeing so many things, and I kind of thought, I want more skills. And so that sort of set me down a road. At the time I didn't have a degree because I had left school, so I moved to Rochester to work my herbal practice, which I did. But at the same time, I also went back to school and thought that I wanted to be a physician. I wanted to be a surgeon, actually, which is totally crazy because I definitely don't want to do that now.
All of those rainbow gathering bloody
Yeah,
moments made you want to be a surgeon.
It did. I loved it, and I liked the idea of like, the acuity and being able to like do a life-saving surgery. And so I went back to school and got my degree in biomedical science. And I was getting ready to apply to med schools, and at the same time, for the last year of my school, I worked as a scribe in a emergency room. So I got a lot of emergency experience. Of course, at the time, I didn't really have a lot of medical knowledge, so I didn't know everything that was happening. But I, remember just thinking like, this is so incredible, and certainly we did amazing life-saving things for people, but. I also felt that there were so many people there who not just were there because of emergency needs, but also because they had a kind of what we call an acute exacerbation of chronic illnesses. And it kind of struck me that, maybe their primary care wasn't always optimal, or they didn't have maybe the healthiest lifestyle, or certain factors had kind of led them to where they are today to present in this emergency room. And as I was contemplating which medical schools I wanted to go to, I came across an article about naturopathic physicians and how in the state of Oregon they were primary care physicians. And I started like thinking about what primary care meant, and to me, true primary care is holistic, right? It's everything. It's not the medicines that you give. I mean, that is holistic, of course, in some ways, but also not. But it's really about like, who is this person, and where do they come from, and what kind of upbringing did they have, and what's their socioeconomic status, and what can they, do to really, not that they are their illness, but how can you, how their whole life kind of is reflected in this illness that they might present with. And so I started thinking a lot about primary care, and I was like, I think I want to do primary care. I get to be somebody's doctor from kind of like start to finish, and help, find ways to manage them and give them like the best life that they can live. And it's certainly not surgery. It's also a much better lifestyle. But as I thought about that, and then I was reading about NDs doing it and how they get to be even more holistic, because not only are we trained to do conventional lab testing, and in Oregon we write prescriptions and all of that, but we also get to do herbs and nutrients and a lot more nutrition and lifestyle advice, all things that I was already passionate about. And so as I was getting ready to send in my application, I changed my mind and I did an ND application, and that brought me to, at the time, NCNM, the National College of Natural Medicine, which is now NUNM because we are a university. Now.
Changed.
Yeah, we got bachelor's programs, so now we're a university, and I spent my last 4 years there, and here we are. That was a lot longer than I thought.
That was good. Yeah, I have come and visited here a few times too throughout when you started, before you started. I visited you in New York.
Yeah.
When you lived in a house where there was like 1 million people living in there, and your study with Sevensong. So I've kind of watched you through the process. Yeah. We went on a cross-country road trip.
We sure did. We did.
During one period where we drove for 24 hours straight or something.
Yeah.
To go to an herb conference in New Mexico. And it's been neat to see the evolution and what you've ended up sort of focusing on, and because I've sort of seen that here and there. I mean, I've obviously we hadn't seen each other in a couple of years before we met up today, but I think it's pretty awesome where you've ended up and how you're integrating all of your experiences.
Thank you.
Can you maybe just speak to what you decided to focus on in your practice as a naturopathic doctor?
Yeah. In my second year, my school has its own clinics, and then we also rotated through some other clinics and practices around town. I ended up out at our Beaverton Clinic, which is a suburb of Portland, and we ended up serving pretty much exclusively Medicaid patients. So that's patients who are below the federal poverty line, or at least some percentage thereof. I loved it. It was an opportunity to, I had a lot of patients who had really common diagnoses like high blood pressure or diabetes who really just didn't know what a lot of those things meant, hadn't had the time to discuss some of the, diet and lifestyle factors there. A lot of times doctors, the medical system as it currently is really values sort of efficiency and moving really fast and seeing lots of people, and so there's not always time. And I felt really fortunate during my education to have hour-long visits with patients, so I got to manage their health and their medications and all that stuff, but I also got to get to know them and learn about some of the barriers that prevented them from optimally getting the best care that they could, or learning about what it means to have diabetes and what kind of foods they should be eating or what they shouldn't be eating. So that kind of sent me on that path. And then at the same time, I ended up working at a federally qualified health center called Outside In, where I got to work with, again, a similar population, including more people who are homeless, a lot of trans folk who were homeless for various reasons, a lot of times because of family dynamics. And I ended up really loving the FQHC world, and ended up going to a few other ones. So I worked at one in Lane County, and then I worked at one called Virginia Garcia, which is a really huge system here in Portland. And the more I worked in those environments, the more I realized that that's exactly what I wanted to do, and to bring naturopathic medicine to those people.
We were talking about a little bit earlier, the kinds of people you end up working with, and it's of course you can't make big generalizations about who all the different populations, but at the same time there are some things that end up being trends, like you're saying,
Sure.
A lot of trans youth who are under 18 who are homeless on the streets because their families aren't supporting them, and which is unfortunate, and they gravitate towards places like Portland or Oregon, where there's resources for people, which is not the case in a lot of other states.
Yes.
And they're both from, I don't know what Maryland is like exactly, but I'm pretty sure maybe it's a little bit more ahead, but a lot of the South, is totally not. People accept it as normal, but it's totally behind in that way of creating infrastructure that allows for people who end up homeless for whatever reason to be able to have basic care.
Yeah.
And, navigating why people are in that position. We have a lot of judgment in this culture about that, that it's that we're encouraged to have,
Absolutely.
So maybe you were talking about meeting people where they are in their culture, or their what they've been, how to figure out how to take something like naturopathic medicine, which can sometimes be really bourgeoisie in some ways, inexpensive, and the kinds of lifestyle things that are really ideal,
Mm-hmm.
and then how to actually move that into real life with working with people who are homeless or who have drug issues or who were in the position of having not a lot of money for whatever reason.
Yeah.
Maybe you could speak to that.
Sure. Yeah. I mean, I think there's a lot of different ways to practice naturopathic medicine, and I think that there's a lot of different places that it's come from, and I think certainly that there is that element of, you know, affluence and people who shop all organic and you know, eat a certain way or live a certain lifestyle, and you know, that's awesome. I myself do a lot of that, but you know, what I love about what I think true naturopathic medicine is that it is holistic. And when I say holistic, I don't mean just herbs and supplements and lifestyle. I mean, it also takes into account someone's culture and someone's ability to afford things. And so sometimes that means giving a prescription over giving a supplement because it's free. Many of my patients, like I said, on Medicaid, and Medicaid does not currently pay for many supplements, but they'll pay for prescriptions. And you know, sometimes giving somebody a prescription instead of a supplement means that they then can afford vegetables instead of only eating fast food for that week or whatever it is. And I think too, being truly holistic, you know, a lot of people, I've had some patients whose entire life consists of McDonald's 3 times a day, sodas upwards of 30 a week, and you know, never drink water. And for me, a win is saying, you know, what about maybe cutting sodas down to 20 a week or 15 a week, or increasing your water from none to a glass to a couple glasses here and there. And I've been fortunate to be, one thing I like about my training was I got to be in the same places for a long time, which meant that I built relationships with people. And you know, I've had a lot of people, some people of course are never going to make certain changes, it's just not in their ability at this time, but I've had so many people who come back and say, oh wow, I feel so much better, like by cutting down on sodas, what else can I do? And there's your opportunity to really do some more intensive counseling. But my view is really more of the harm reduction view of, I don't want to take away because that doesn't really work well. It's easier to find what's in their life already that we can modify to make maybe healthier or better, or help them make choices that aren't going to be completely foreign to them, because I think that people resist those, and instead make a choice that is more in line with their life.
Like asking someone to drink tea and like make this blend every day, and who's maybe never drank hot tea in their life. Totally.
Or even people who do, like I love those things, but I would struggle to make a decoction 4 times a day, even if it worked, you know, like I don't have time for that. You know, so I've had to really adjust my treatment plans. And actually going back to Sevensong, he was one of the ones that really kind of grounded me on that, because I used to, when I first was studying herbs, like, oh, well, I could like give them this tincture for the morning and this tincture for the night and this tea during the day and then this decoction before bed. And it's like, maybe that might be awesome
if you're an herb student,
but like who has time for that? Even as an herb student, I didn't have, you know, I've never really had time for that. And now I know so many of my patients being, you know, having the kinds of jobs they have, a lot of them are migrant farm workers. Like even taking a day off to come into clinic is huge for them, because that's income loss, and it's you know, many of them have kids here and they have to find a place to put them. So it's not easy to integrate that into your life. So I'm really passionate about trying to find like simple ways to integrate things into someone's life that maybe they just need like a little tweak here and there.
That came to me too. I mean, I don't have any kind of clinical practice, or, I mean, I'm kind of curious about it now more as I get older, but being from a rural place in the South where there's not a lot of money and not a lot of access to organic or to, you know, organic vegetables or meat or supplements really that are quality or anything. And like, basically it was like, well, just go to Walmart, because that's the only place you can go, and you'll find the flax in this aisle. And literally going, and I had a few people ask me questions. Some of this stuff was way over my head, like thyroid issues. I'm like, I can't I don't feel qualified to help with that. But just literally doing the research in my town of like, what actually could I tell people? They're like, I just want to find this one thing that I heard is helpful. And I'm like, okay, so I literally go in Walmart and try to figure out where that thing is. Even just, working within what's in that place. And it's unfortunate that we even have a system in place that doesn't allow for it to be easy for people to take care of themselves in an optimal way. I mean, organic food's not subsidized, but like monocrop, soy, corn, all these things that are processed food are subsidized. There's so much more to the conversation of accessibility for herbs and healthy foods that it is really a big issue, I feel like, in the nutrition, herbal medicine, and like alternative health world. And a lot of people don't want to do the work to figure out how to think of it differently in that way. It's like buy the expensive supplements or powders at superfoods and all these things, which are great too, but like you were saying earlier, like figure out ways to just allow space for someone to eat a few more extra vegetables this week, and that's it, or like drink an extra glass of water, and that's a win.
Yeah, little things really, they make a big difference. I remember going to the first place I've heard this was the AMSA conference. It's the American Medical Student Association conference, but I've since heard it at a number of different places and pretty prominent people who say, your zip code is a bigger determinant of your health than your genetic code. And really what's behind that is that the places that you live really have a big impact, especially one of the things that I hear connected to that is the concept of sort of food deserts and what's available for people who in those areas likely don't have access to a lot of transportation, or it's not feasible for them to be traveling really far to get groceries. And so what's available in those areas, and it's going to be cheap processed foods because that's what's cheap and available, and that's what people know. And so there's that. And then of course, when you grow up in those areas and you don't have maybe access to, learning how to process food yourself or cook or how to shop or what to do. I've had so many patients tell me like, well, I bought the vegetables that you told me and they rot in my fridge because I don't know what to do with them. So that was a big eye-opening thing for me,
So much more than just telling someone to change something. Like you end up actually having to educate yourself about all these other aspects, like you were saying too, of Hispanic culture, and actually like educating yourself about what would work for people who don't come from a culture where they even know what kale is,
right. Yes, exactly. Yeah, it's really interesting to see, and to know too, like, you have to figure out what to ask, because if you don't ask, a lot of times people won't say for various reasons. And it's been a really interesting experience to say, okay, what do I need to ask to make sure that this person not only knows what they should be eating or doing, but how to implement those things
and why it's helpful.
Yeah, exactly. And why are they doing that? Because that also doesn't help. If somebody comes and says, well, I've been doing what you say, but they don't know why, then the likelihood of them sticking to that is a lot lower.
And you were speaking to food deserts and the zip code relationship to health. I mean, of course, race and class are all intertwined with Absolutely. Who ends up in food deserts too. And you did you live in Baltimore at one point?
No. Well, only for a summer.
Yeah. I mean, so anyhow, I just think about that place too with food deserts. But like basically a lot of people of African Americans end up in food deserts by the way that structural racism is played out in our
Absolutely.
culture, and how people are put on this side of the river and that side at one point, and then they end up not being able to. It's not that easy to just be like, oh, I'll go up to the other side of the river, and then the resources are not like put in those places,
Yes.
It's crazy.
Yeah, it is. It's crazy, and it's really unfortunate. And one of the places that I'm trying to be now is like I've heard a lot of these things, and everyone sort of agrees about them, even in very conventional settings. face will say these things, but I don't necessarily know a lot of how are we combating it.
Mm-hmm.
There's a lot of talk of like, okay, this is a problem, but what are we doing about it? And I don't necessarily know. I don't have the answers for sure. But I think for me, finding my work in the community health center, federally qualified health center world has been a place where I can at least feel like I'm making my impact on those communities. But I think that for the bigger picture, it's going to take policy change and a lot of large scale things.
Yeah, and like where to even begin with that. And I mean, obviously, having a healthcare system where people who are under the poverty line or at the poverty line can access basic care is a start. I mean, and the conversation around like whether we should have basic health care or not for all, it's kind of just crazy to think about how some people really do feel like it should only be for those that can afford it. And it's just that the reality of living in a capitalist society is that everyone will ever be able to afford it, and paying $300 to $600 a month just to be covered in case you get sick or an emergency. And it doesn't have to be that expensive either to create infrastructure for it to be available for people to even just see someone about basic health concerns. So, I mean, I don't know what it will take for that to all change. I mean, in some ways, I feel like there's been progress. In other ways, obviously, there's been lots of steps back. And, and Oregon is also has lots of issues and all kinds of things going on. I don't live here. You do, so you know more about that. But for you to be able to do this here, it wouldn't be possible in a lot of other places, it seems like. So
yeah, it's pretty nuanced and complicated, and I certainly feel more connected to Oregon's resources, so I don't know every state. Medicaid is state, is sort of run by state, and so determining who qualifies and how much funding they're going to get or take is often very dependent on the different states. Certainly as a provider in the sort of safety net medicine world, I and most others in my line of work believe that, we all deserve health care and are supportive of that. But how that would happen, of course, I don't necessarily know. But yeah, I think one of the things that always strikes me is, the cost of what happens when people don't have health care and then things sort of get really bad versus, catching things early and being able to treat them when they're still much more treatable, or being able to educate someone when, there's time to educate.
Versus people with no health insurance end up in the emergency room, which is really more expensive.
Totally.
Oh,
yeah.
Serious. And then every day they're there is like an enormous amount of money. And
yeah, it's either, they're going to end up with a giant bill, or the hospital ends up with a giant bill, and it's really not ideal. And, I like to think of diabetes as such an easy one to kind of talk about. And of course, I don't want to make blanket statements that everyone can avoid diabetes. Of course, people will have it, but there's a simple blood test that we can run and say, okay, right now your average blood sugar is such and such, and you're very at risk for diabetes. And that's a great opportunity to discuss with someone, like, how can we, go the other way? Because you don't have diabetes, your blood sugar is too high. Like, let's talk about some foods that you might want to incorporate, or some things you might want to avoid, or some ways to move your body that feel good for you. And when those people don't have that opportunity, 15 years later, they end up with kidney disease and heart disease because they got diabetes somewhere along the line that has been unmanaged, and they end up with neurological symptoms, painful limbs, because that's all the sequelae of what happens with untreated diabetes. And it's like, that was an opportunity, and now of course it's going to cost them or the system so much more, because now they're going to need a lot of medications and to see a lot of different people if they're even able to. And then of course, if they're never able to, diabetes can be deadly. So it's not ideal. I really think that we don't have the correct focus, and I think this kind of speaks to like a larger political theme that I feel I see, which is kind of the Band-Aid solution rather than like making some sacrifices in the now so that we can have a better later. But it seems like we tend to do a lot of like, well, let's just, do what we can now or fix the little thing and ignore the bigger problem. But it just kind of gets larger.
Yeah. Because even when Obama passed the
Affordable Care Act.
Affordable Care Act.
Yeah.
People call it Obamacare, which I
yes.
think is weird, but the Affordable Care Act, it still had its own issues, of course, and I mean, that's a whole conversation that I don't feel totally qualified to like argue about what about it is good or bad, all the nuances.
Mm-hmm.
And maybe wasn't drastic enough because it still was expensive and still didn't really reach everyone and still like, making it state by state, honestly, to me is really crazy because so many people don't just live. I mean, of course, I have a unique experience of moving across state borders, and I've found it being really complicated to be able to like make sure that if I get a car accident somewhere, I'll be okay.
Mm-hmm.
Of course, I have privilege to be able to move across borders in the way I do, but anyways, I don't know what the solution is, and I'm not an expert on it, and I don't know the budgets and the ins and outs, but what you're saying about focusing on preventative care or like diagnostic early on with people will help the system be less expensive and help those people have better quality of life for longer.
Absolutely.
And yeah, that we don't have a system that allows for that is definitely problematic. And right now I don't feel like it's gonna get any better for a while, but maybe it's the dark before the light or something, in that way.
Yeah, I mean, not to get too political here, but
I know.
I think there is a fundamental difference in feeling of the people who feel that some people don't deserve care, and until that changes, I'm not sure that we'll see a federal change. So many people, and of course I couldn't quote statistics, but it seems, or from the polls I see, that so many people just flat out don't support any kind of universal health care or universal coverage for everyone, and whether that's because politicians label it socialism or because they think that it makes people lazy or whatever reasons there are. I feel like that's a fundamental change that will have to happen before we see that.
And people feel like that if they've worked hard to make enough money to afford health insurance, why should someone else who doesn't make as much money as them get the same thing they get, which is just, I don't know. It's weird. Like, not everyone is in a position of being able, that just doesn't even start to visit the like structural racism and all these other ways that communities are marginalized in our culture and how they aren't able to as easily work themselves. And that's a tricky conversation I don't necessarily want to dive too far into because I don't know if I know all the right things to say about it and if I really even know. But the economic ability to, be able to... I even think people who have a lot of money pay too much for health insurance. It shouldn't be like that. Like, it should be just either a flat rate for everybody or free or, like, subsidized something. I don't know. Like, it's gotta be... or, like, certain things, like just going to check your blood pressure. Shouldn't be that hard. Like, I tried to get a breast exam, actually, in California, and it was going to cost me $400 when I didn't have health insurance. Just to see if I had a lump. Yeah. To make sure. Yeah. And there was nothing, it was complicated, the whole situation, but I was like, really? Like, this kind of thing, like, even should be free, like, and super easy for people to be able to do. Yeah.
Yeah, I definitely think there needs to be some changes, but I do feel quite privileged that I have found a way, at least, to work within what we have right now and provide the best care that I think I can to the most number of people with what we have.
So you also work with people who have substance abuse or substance issues. I don't even want to say abuse because it's really like a complex subject. Do you have any? Can you speak to that at all? I've seen you post a little bit on Facebook and about. Yeah.
I didn't ever think I was interested. So originally, when I started medical school, I said I was not interested in mental health at all. And of course, I have ended up doing more mental health than anything else. And part of being in the FQHC world, the community health center world, I've definitely also experienced a fair share of patients with substance use disorders or substance use issues, if you will. And yeah, it's something that I didn't think I was interested in, but I actually am really interested in it. There's a lot of feelings around it. I think I've spoke to this a little bit earlier about kind of holistic medicine and harm reduction, and that's also my sort of bent into substance use as well. I mean, I do think that for a lot of people that complete avoidance or abstinence is great and that works for them. But I'm of the belief that any way you manage your substance use disorder is okay. And so that people who need long-term treatment, so specifically with opiates, many patients choose to be either on methadone maintenance treatment or the newer medication, buprenorphine or Suboxone, and that's how they manage their opiate use. And I think that if that works for them, that is totally 100% acceptable. I recently heard a provider giving a kind of example, and he would say, if you need a math tutor to pass a math class and you pass the math class, then you pass the math class, right? Like, who cares how you do it? And that's my take. There's definitely some people who feel differently from me, but I think that it's supported by both the published literature. It's also supported by the large addiction medicine. So ASAM, which is the American Society of Addiction Medicine, also supports that line. That's been my bet.
I mean, I've been thinking about this a lot lately. I don't have anyone super close to me that has substance things going on, but I have friends of friends that have had people die from it or like have had committed suicide because of it or things like that. And it always comes back down to me is that we're still not analyzing the reasons why people even feel like they need to turn to something like opiates or other substances to manage their life in this culture.
Yeah.
Or how they even got on in the first place was often is because a doctor prescribed them pain medicine and then kept increasing their dose. That's not always how it happens.
Yeah.
And then they end up addicted to it, and it's like because that person was making money off of it. I know that's super controversial, but that's the reality of a lot of scenarios, and then people end up homeless because of the opiate addiction, and then your brain is changed by that. You can't just stop.
No. Yes.
You can have major things happen to your body if you just stop cold turkey.
Oh yeah. So I think it's a really complicated and nuanced subject, and I won't speak too much to it. I think that one of the issues, I think that people were well-meaning in general, and I certainly know that there are some controversies around why people prescribe different things.
Yeah.
I think that one of the issues that happened was in, the earlier times. So, and I might be getting my times wrong, but I'm new to medicine, so forgive my timeline if I'm off, but I want to say the sort of 90s and early 2000s, pain basically was considered, not acceptable. And so it was taught kind of patients should not be in pain and therefore take away their pain and therefore give opiates. And so anyone who had pain, including things like chronic back pain or whatever it was often given certain kinds of opiate-based medications for their pain. And then, of course, there was the time-released opiate that was presented by that particular pharmaceutical company as not being addictive, which of course turned out to not be true. So it's quite complicated, but I think that is definitely one way that a lot of people get on opiates. And then of course there are people who just end up starting on heroin for whatever reasons. And in terms of how we prevent that, I think that largely remains unknown. One of the things that I see happening in a lot of clinics is the use of something called ACEs, which is the Adverse Childhood Experiences Score, and it's essentially a tool that helps screen people for adverse childhood experiences, domestic violence and drug abuse and all kinds of things. It's pretty comprehensive, and it's been shown that people with very high scores are more likely to have certain substance use disorders as well as to have more physical health problems, which of course is interesting in and of itself. But a lot of clinics will use those and then maybe be more aggressive with monitoring or asking people about substance use when they have higher scores. And I think really just being open-minded and asking patients or clients or people, how is your mental health? How are you feeling? Like, what's your life like? And kind of looking for reasons for kind of depression or anxiety or traumas that might push someone towards using, and making sure that you're screening and being open-minded to, that person's pain and acknowledging it, and giving them the appropriate treatments or referrals or whatever it is.
Seeing them as a real human being.
Yeah, seeing them as a human being and acknowledging what they're experiencing, because I think that a lot of times, and I certainly don't want to make any blanket statements about why people use drugs, but I think a lot of times people feel invalidated about what they're feeling for whatever reasons. We don't tend to, as a society, seem to encourage people to talk about their feelings or feeling depressed or anxious. We don't want to hear about it because it's difficult or makes us sad or whatever.
There's shame then wrapped around that inability to communicate what you're going through. Totally.
And so my view has always been, as a provider, is to be as open-minded as I can and really to take away shame and stigma around mental health, because I think that also leads to a lot of substance use. And just be open to people, and then of course if somebody is using substances, to not come at it from a shaming place or make them feel bad about it, but really just to say, we're here for you, or I'm here for you, and we have tools for you if you want to use them. And sometimes people will say, look, I'm not interested in stopping right now. And so that's an opportunity to talk about safe use rather than stopping. And I've done that with some people and had them come back and say, okay, I'm ready. And some people won't do that. How it kind of goes.
I mean, and then that choice to decide to not stop using is complicated. I mean, again, if you've studied the way that these things affect the chemistry of our bodies, then you can have more empathy too for what it literally does to you, and makes it you feel like you can't live without it.
Yeah.
And you're scared to know what it would be like to try to stop. So
Absolutely.
it's really scary, and I think the empathy factor is really important, like you said. So, and not coming at it in a place of shame and judgment. And I know a lot of people disagree with all of this, and we're definitely touching on a lot of really controversial things in the conversation. We didn't quite realize we would touch. And you were looking at me like, oh, let's go there. All right.
Yep.
And you being a doctor, and you have so much more liability and things to lose, and you got to be careful. Also complicated to figure out how to help people manage pain.
Absolutely. I think that a lot of people mean well, and it's very challenging when you have someone in front of you who says, I'm in pain, and you want to validate them, and you know, make sure that they feel heard and that their pain is real, while also knowing that long-term opiates are rarely, if ever, indicated. But it can be challenging when someone is sitting there and saying, you know, that's what I want, or that's what I need. It's complicated for sure, and it's definitely not a good road.
Yeah. There's something you posted about on Facebook about, and another friend has told me about it, something you can take that will, if someone had an overdose, the controversy around it. I'm just curious if you're able to use this drug. I guess it's a drug in itself that makes it so that your opiate, the receptors are not holding on to the opiates or something.
Yep. So Naloxone, it's called Naloxone. The brand is Narcan. And Naloxone is the generic. Naloxone is a prescription that is an opiate antagonist. And so basically when you give somebody Naloxone, it forces the opiates on the opiate receptor to come off and basically replaces it. And it will end someone's high. It will also revive a person who has overdosed. And some people are not too happy when you give them Narcan or Naloxone because you ended their high. Also, if you are opiate dependent, then you will, of course, go into pretty immediate withdrawal. So it can be very uncomfortable. Yeah.
What does that look like?
Opiate withdrawal, there's a lot of, it can be different for different people, but there's some pretty common things. So opiates tend to kind of bind everything up, make things dry. So constipation and dry membranes. And so a lot of times you get a reversal of that. So there's a lot of runny nose, your eyes can run, pupils can dilate, your skin can get like that, what they call it the chicken skin. Piloerection is the medical term, but your kind of hair stands on end, lots of sweats and pretty significant GI or stomach upset. You don't feel too hot. So I would say it's akin to feeling kind of like a bad flu kind of feeling. At least that's how I hear it described. Not comfortable. Yeah. People don't like it.
But the purpose of this particular drug, I don't know what you call it, but
it's a drug,
is to help people not die from overdose.
Yeah. So it's exactly, so it reverses the overdose. And so in Oregon, I can't remember what you have to have a training. If you're not a medical provider, there's a training you can do where you can basically be a lay person without a medical license who's trained to use Naloxone, which I think is wonderful. I think everyone should have access to it. It's super simple and easy and can save lives.
Is that something that was available when you went to the Rainbow Gathering at all, or was that was been a while? And the Rainbow Gathering is in a different state every time. So
so I would say that my medical knowledge of that at that time, I wouldn't be able to speak on it. I think I vaguely knew what it was, but not as much as I do now. And a lot of the laws around like who can use Naloxone or get it is more recent because of the opiate epidemic and wanting to find ways to really
help
reduce harm. Yeah. But I do believe that it should be available to everyone.
I think that the other side of the argument of people who don't feel like it is something we should have available is that it encourages people to keep using, I guess, but then, or it doesn't really address, like you're saying, like trying to get people off the drugs. It just like temporarily helps. But at the same time, it's not like that someone's having a good experience when they're using it. It's not like they're addicted to that thing. it's just literally keeping people from, I mean, it's sometimes overdose happens accidentally, or like it's laced with something, or like
Sure.
all these things, reasons for it can happen, and it's like,
Yeah, I think I haven't heard too many people being against naloxone because that generally just reverses what's happening, and makes, you know, the kind of opiate overdose leads to respiratory depression, and that's often how somebody can die, is because their breathing muscles basically aren't working, and so they can't breathe. But the other one, so buprenorphine, or also sometimes naltrexone, can be used, and that I find more people tend to be against, and that's more as a maintenance drug to stay away from prescription or street opiates like heroin. And that's the one that I hear more controversy about, because being on that, many people choose to be on buprenorphine and or naltrexone for life, and that is where there's a lot of controversy, because people say it's not addressing, you know, the issue that they have. But what I think people fail to recognize with those people is, like you have pointed out a few times, is that their neurobiology has changed permanently, and there's not a lot of ways to get that to go back, if at all, even if you address the original root causes that people went into it for. I don't see, you know, our neurobiology it's hard to rewire things, and when you go down that pathway, those pathways get pretty strong, especially with that repeated use, and sometimes people have been using heroin for years before they end up on buprenorphine. And so I don't view using buprenorphine maintenance treatment, or even methadone maintenance treatment, as a failure if that person is able to live a life that is consistent with the way they want to live. So, you know, able to get their families back, or find meaningful work, or meaning in their life. Like, I don't care how they choose to be in recovery. That to me is still recovery. That is controversial for some people, but that's my take.
Do you use any plants in your practice in relationship to drugs addiction?
With drug addiction, let's see.
I mean, I've taken classes on it, like California poppy and other plants that can help mediate things, but not necessarily as a replacement. But just curious if you have any thoughts on that.
I haven't too much in that particular area. Sometimes some of like the GI side effects people have had, like people have done some like tinctures or infusions for feeling better in that regard. A lot of, you know, it depends on how severe their withdrawal is. So many people need to be in like a detox center during the acute withdrawal, because their needs are much higher than an outpatient setting can handle. But for some people who have mild withdrawals, that can sometimes be feasible. I've definitely used some plants for mental health things, but not so much substance use at this point.
It's pretty serious thing. I mean, I took a couple classes at one of these herb conferences that are more advanced about like what plants can do in relationship to your opiate receptors and stuff, certain plants, but it's still not. It'd be nice if there was like more research done to figure out how to make that more available, and like, you know, I don't know, for it to be really something that could help alleviate someone's suffering, you know?
Absolutely. Yeah. I always want to see more research done, especially with natural products and plants. There's nowhere near enough of it. Yeah.
Well, we could talk about so much more related to all of this. I know we got pretty deep and dark a little bit and intense, but I really appreciate that you're doing this work, and I hope, I was saying earlier, we need like thousands more people like you doing this, who are like going through all this education, who have a lot of school debt and who are choosing not to get the big fancy job to pay it back as quick or whatever, you know, like serving this population is definitely like a labor of love and is important and needed and necessary. So thanks.
Yeah, well, thanks for talking to me about it. I feel really grateful that I get to do this work. So,
So you are planning to stay in Portland or in Oregon somewhere?
Yeah.
And that's what your plan is. And
yeah. I've spent a lot of my time just getting to know the resources here and the medical community here and the needs of the people who are here, and I feel really comfortable here, and like I can do the most with my education here. So yeah, I see myself here. Cool. Plus we have good food and hiking.
Yeah. Well, thanks for sitting down and talking to me about all this and getting to catch up a little bit about all this stuff too.
Thanks for having me.
Yeah. Okay. Bye.
Bye.
This episode of the Ground Shots podcast was produced by Opia Creative. Our music is by Mother Marrow. If you'd like to help us continue to make this audio project a reality, consider becoming a monthly supporter on our Patreon page at patreon.com/ofsedgeandsalt, where we have rewards like entry into patron-only giveaways, additional audio interviews, extra educational content, and much more. You can also share our work and give us a review on iTunes. Visit our website at ofsedgeandsalt.com to see what else we're up to and a log of our episodes when they come out. Check out our show notes for information about how to find us and our guests. Until next time, y'all, thanks for listening.